Good afternoon, everybody. I hope that you're all doing well. You might have expected to see Harmy today, but he's actually teaching an OET class here at the school, so you have me today. So in this lesson, we're going to be looking at writing, and particularly how to select, organise and transform the case notes. And we're going to be looking at a specific task, something that hopefully you haven't seen before, and we're going to go through that together on how to select the relevant case notes, and then we'll look at how they've been transformed and organised. Now, as always, my colleague is here answering your questions in the comments on Facebook, so any questions or any comments or anything like that, if you just want to say hi, that would be great. Just let us know where you're from and we'll try and help you. So hopefully this lesson you will find interesting and be able to take something valuable away from it. So with OET, we like to think of there being 3 stages of writing. The first one is selecting the case notes. That's what is relevant, semi-relevant and irrelevant. And then we have to organise them. And we think of 2 ways of doing this, and that is chronologically or by order of importance, but we'll have a little bit of a talk about that later. And then finally, we transform them. What you have in the case notes, you don't want to replicate in exactly the same way. You need to paraphrase and use your own language. So we've got select, organise, transform. So these are the case notes that we are going to be having a look at today. Don't worry if you can't see this now. This is just so that you get an overall picture, but we are going to zoom in on everything and talk about everything individually. If you do have to leave the lesson at any time, you can always find the same lesson or the recording of this up on the OET videos section. If you go to the OET Facebook page and go to live, you'll be able to watch this afterwards. So with the writing subtest, you have a total of 45 minutes. So let's break that down. In that reading time of 5 minutes, there are lots of different things that you need to do. So the first thing is, what type of letter do you need to write? Is it a referral? Is it a discharge? Is it a transfer? You need to think about the purpose, and that is part of the writing criteria. So it's really, really key that you identify this as soon as you can. And that is just, why are you writing this letter? And of course, that then incorporates, who are you writing to? Why are you writing to them? So who is it that you're speaking to, and what do you want them to do? And it's also useful to think about, do they know the patient? Because that's going to help you know what to select or what to leave out. So we choose the case notes, we select what is relevant, what is semi-relevant, so that's stuff that you might put in, maybe secondary issues, things like family history sometimes come under semi-relevant. And then what is irrelevant, what can we just completely discard? And you'll find with case notes, there is a lot of irrelevant information. It's useful to get a kind of overall picture of the patient, but there's a lot that you will not need. You can just cross it out. And then you've got to think about your organisation. And that really is, it's kind of to do with sentences, but it's more to do with paragraphing and the way that the paragraphs fit together. So here at West London English School, we like to talk really about 2 different ways of organising your letter. One is chronological, and that means that you're going by dates. So for example, you might have the first visit that the patient had to you. Then you might have in your next paragraph the second and third visit, and then you might have the most recent visit. So you're going in order. Another way of chronological could be that you start with the most recent visit and then you go backwards. So the previous visit and then the previous one before that. And then we have organising by order of importance. So that means the first reason, why are they here today? And then you might go into some symptoms or some kind of history, and then you go into the secondary issues. And then at the end, you'll probably have something like future appointments, maybe a discharge plan or something like that. And then we've got our writing time. And ideally, you're going to spend about 30 or 35 minutes writing and 5 or 10 minutes at the end to proofread. So you've got those 5 minutes to read, but remember, it's really important. You're not allowed to use your pen during those reading time of 5 minutes. So that means read through everything, start selecting what's relevant, what's irrelevant. And as soon as they say you can start writing, pick up your pen and go through the case notes, marking what's relevant, what is irrelevant. And that is all part of your planning. Planning is so important for the writing because you have to select, organize, and transform. And leaving time at the end to proofread everything is really important as well, just to make sure that you've included everything that you wanted to. You can check through for any spelling mistakes. You can go through and see if there's any grammatical problems, any miscollocations or anything like that. So proofreading is something that you definitely should do. So let's have a look at this case. We're going to start with the writing task, which is usually the first place that I would suggest you begin, because that's going to help you identify the purpose. So from this, we can see what type of letter you're writing. It's a referral letter. Who are you writing to? Well, Dr. Jones is the recipient and he or she is a dietitian. She, because it's Barbara Jones. And why are you writing? What's the purpose? Well, in this case, it's for further management of the patient's gluten-free diet. And we can see where we need to address the letter to. And we can see that Dr. Jones works at the hospital. And what's interesting is that while this is a referral letter, you'll see that in the case notes, it's known as we've got a discharge plan. And within that discharge plan, we can see the purpose of this letter, refer to a dietitian. So anything related to the diet, the gluten-free diet, or the diet in general of the patient, Rosemary, we're going to need, like here, gluten-free diet, and eliminate gluten from diet. So we can see that all of this is going to be important. So now we're going to think about the purpose. We're still in our sort of 5 minutes reading time, and you need to consider who you're writing to, why you're writing to them, what do you want them to do, and do they know the patient? So we are writing to a dietitian, Dr. Jones, who works at the hospital. We're writing to refer our patients. We are the doctor that's been looking after them, and we're referring the patient. And we want them to further manage the patient's diet. No, they don't know the patient, but it might be worth just thinking about or remembering that you work in the hospital and the dietitian works in the same hospital. So they don't know each other, but they work in the same facility. And what does the recipient need to know? Well, they'll need to know about Rosemary's symptoms and her stay in hospital. And then everything related to the dietary needs of the family. Because she is celiac and needs to have a gluten-free diet, anything related to the diet or the family's diet needs to be included. And you'll see that the patient is 15 years old. So she lives with her parents. And that means that, as is written here, her family's dietary needs will also need to be included, because it's very unlikely that she is cooking for herself, but her mum or dad will also be cooking for her. So let's start our selection process. We're going to start right at the beginning. So if we just go back, you'll see all the case notes here, and we're just going to take that first section, which is here. Now, I'm going to give you 30 seconds to look through this and decide what is relevant, semi-relevant, and irrelevant. If you want to, you can type your answers into the Facebook comments, but if you just want to think about it, that's also fine. Okay. So first of all, being responsible for the care of Rosemary is your position. You have been responsible. So this is something worth thinking about when you are writing your letter. As well as knowing who you're writing to, you also need to know who you are. So we're going to select this. Now we need to know as well that she has been admitted for abdominal pain. Of course, we need her name, but it doesn't matter that she is single. Her address isn't important. Her date of birth is, as I said, she's 15 years old, so her family need to be involved. It's not too important about her mother, her mother's name or age or her job. And the same, if we look at the social background, she attends a high school and she has good results. Well, that's really good news, but it's not important for the dietitian. We might possibly say that she's been too tired to do anything, but as we know later on in the case notes, we know she's been diagnosed as being a celiac. So it's semi-relevant. And having a good relationship with her family. Again, it's great. It's good to know that, you know, she has a family and we've got to consider their diet, but it doesn't matter really that she has 2 younger sisters. We're going to have a look at the next bit. So again, I'm going to give you 30 seconds to go through what is relevant, semi-relevant, and irrelevant. Okay, so looking at her past medical history, the fact that she was born premature is not going to be relevant to a dietitian because it's not related to the problems that she's having now. If she's had stomach issues and she's been diagnosed as a celiac that needs a gluten-free diet. And that's exactly the same for the bronchiolitis. However, the asthma could be something that is included just because sometimes asthma and diets could be related. So it might be useful just for the dietitian to know. So we can say that that is semi-relevant. No surgeries is fine. There's nothing unique about that. But no allergies is definitely going to be important. Remember that the purpose of this is for further management of a gluten-free diet. So if there's no allergies, it's, you know, the dietitian will know what they can include and what they can't include, although in this case it's only gluten-free, so no allergies to celery, to dairy, to eggs, to anything like that. And with the family history, before we said that the mother wasn't important, but now the mother and the father are both important. And the reason for this is that diabetes and Crohn's disease are both related to diet. And as we said, this patient is 15 years old. So she's not cooking for herself, but her whole family will be probably trying to eat the same meals. And they must already have to accommodate for the diet of the mother and the father. So the family already has dietary needs. So it's worth the dietitian knowing about. The next section, again, 30 seconds. Okay, so we're looking at a specific date now, and that she was admitted to A&E, which we might want to say that, you know, to show that this was an urgent situation or a big problem, a big issue. And the presenting problem, here we have our symptoms. Now, if we're thinking about, persistent diarrhea, greasy stools, abdominal pain, and a rash, all of these are associated with being celiac. So all of those symptoms are going to be important because the dietitian needs to know what the patient first presented with, how they were dealt with, and then the management. A similar thing here. If you get sudden weight loss or if you start bruising easily, these are indications of having celiac disease. So those are relevant as well. However, the vital signs are not very important. And the reason for that is just because she is a patient, a nurse would have taken vital signs at the time, but there is no issue with these. And again, it's not important for a dietitian. So the symptoms of why she was diagnosed as celiac are important, but everything else, her blood pressure, her pulse, her temperature, this is not important. So here is some more details. And again, you've got 30 seconds to choose what is relevant, semi-relevant, and irrelevant. Okay, so of course her diagnosis is important. Now, if we look at these test results, hematocrit is, as it says here, the ratio of the volume of red cells to the volume of the whole blood. So we're comparing red blood cells there. And this is low, 25% is below the normal rate. So we know that Rosemary, the patient, is anemic. So this is something that is maybe semi-relevant because, as you know, anemia is due to not having enough iron. It's an iron deficiency, and iron is of course related to diet. So we'll say that's semi-relevant, and something else might come up about the anemia later on. MCV is the mean corpuscular volume. Again, it's something to do with the blood. It's not really important. And then the white blood cells, so the white blood count. And again, that's not going to be important for a dietitian. This was just the test results that basically were confirming that she had anemia, and it's going to confirm that she has celiac disease. So again, the platelets are to do with the blood. PT and APTT are tests for bleeding and clotting. Again, it's not important for a dietitian. Her calcium was low, but it's not too important for a dietitian. And the results here of the stool culture, the white blood counts, the parasites, they were all negative. So if they're negative, then it's not going to be important. It's that there were no issues with these tests. She doesn't have that, so it doesn't need mentioning. Steatorrhea is a test for greasy stools, but as it says here, already confirmed. We already know, if we go and remember back, that her symptoms, one of them was greasy stools. So even though this is positive, we already know this, so it doesn't matter. Now, if we look at these antibody tests, all three of them are related to being celiac. So the anti-tissue transglutaminase, I think that's how you say it, is a specific antibody for celiac disease. The next one is found in 90% of celiac disease cases. And then the last one, if you have a deficiency of this antibody, then it can indicate celiac disease. So of course, because of the diagnosis, it's worth mentioning all of these just to confirm the reason why you came to that diagnosis. And then the fact that Rosemary was transferred to the pediatric unit is probably going to be relevant. We can say it's semi-relevant to relevant. We know that she started in A&E and then she was transferred. So she's been staying in hospital. So yeah, that's the reason why it's relevant. Now, the reason that all of these other X's, again, is just it's not relevant for a dietitian. So you might be going through it thinking, oh, interesting, and getting into the mindset of this patient and understanding everything. But for a dietitian, it's not important. That's why it's so important that you always remember, who are you writing to? Why are you writing to them? Okay, the next bit, and again, I will give you 30 seconds to look through this. Okay. So we're looking in over the next couple of days, and we can see that more tests were performed. So that might want to be added in there just to explain to the dietitian. Obviously, dietitians deal in some way with bowels, so that might be something that you want to include as relevant. And the same here about lymphoma. And of course, all gluten needs to be removed from the diet, so that must be included. Now, ferrous sulfate is a medication that's used to treat anemia. We're not going to include it from this point of view because there's so much detail. It doesn't need to say in your letter 200 milligrams, 12 hours, blah, blah, blah. But it might be worth mentioning that she's on the ferrous sulfate. Again, we're going to see more detail about this later. And the same thing here. You might say that she's on albuterol, that she's going to maybe continue on her medication, because as we said, asthma and the diet could have some kind of correlation, but there's too much detail there. And then finally, we've got the nursing management. Well, this is a paper for medicine. The letter recipient is not a nurse. So none of this is important. When you see nursing management, if you're not on that and the discharge plans, there's nothing about the nursing, you can discount it. Okay, here's the next bit with the discharge plan, and I'll give you 30 seconds. Okay. So with her medical progress, it's been good, but it doesn't matter. This is a diet. I mean, well, it does matter, of course, but it's a dietitian. So it's not important for the dietitian to really know because they know that she's being discharged anyway. Now, the diagnosis has been confirmed, and all of the details about what else was discounted or excluded was further up in the case notes. So it might be worth adding that in, just like we had then something about the intestinal wall and the bowel. So that's why you might want to include that, just to say we've excluded all of these things and we've diagnosed this. The patient being ready for discharge doesn't matter too much, but of course we need eliminating gluten because it is the purpose of the entire letter. Now here we come to the ferrous sulfate, and remember that that is given for anemia. So it's worth a dietitian knowing about that, just because anemia and the diet obviously are related and have a correlation. A gluten-free diet until there is a result from the symptoms and that everything has slowly gone away and she's feeling better, so that's important. And because of the calcium, we didn't mention it before about her level, but now we probably would mention this just because, again, it's something for the future that is related to her diet. And of course, referring to the dietitian is the purpose, so we would definitely need to include that. A lot of the discharge plan here, even though it's towards the end of the case notes, it's something that's going to go in your introduction, because in your introduction, that is where you need to explain the purpose of the letter. So let's look at the sample letter for this. So this is us transforming everything that we've just selected into complete sentences, and we're going to just have a little analysis of that. So here we have our introduction. We've got thank you for seeing Rosemary McQueen. So here we know that when we say thank you for seeing, that it is a referral letter. And then we've got the purpose. I would be very grateful if you could instruct her and her parents about the management of her gluten-free diet. Again, the reason we've got her parents included in the purpose is because she's only 15 years old. Now, a lot of people write their introduction as I am writing to refer Rosemary McQueen, who has recently been diagnosed with celiac disease. And that is a perfectly good way of doing it as well. But thank you for seeing is a really nice, polite and formal way of also beginning a referral letter. But we do have some other options. So you could say I'm writing to refer. You might use a short, a positive, like Miss McQueen, a 15-year-old student, is being referred for like further management of her celiac disease. Yeah, so, or Miss McQueen is to be referred for further management of her diet, having been diagnosed with celiac disease. It's much shorter, but it's still the same kind of thing. And then we've got our next section here. Now, have a look at the two of these. I'll give you some time to read it and see which one you prefer, which one's better. Okay, now the first one is almost word for word copied from the case notes. So the case notes had presented with, and then the symptoms: persistent diarrhea, greasy stools, abdominal pain, weight loss, easy bruising. So while the sentence at the beginning, the first one, it does sound quite good, but it's copied from the case notes. You're not showing off your level of English here. And remember, that's the point of this writing. It's to show off your level of English. Now with the second one, it's much more detailed. So for example, with the weight loss, we can see it's 2.5 kilograms. And they've used their own words. Instead of abdominal pain, they've just changed it around. It's quite easy to do, just pain in her abdomen. Have a look at the next section. So we've got the antibody tests from the case notes at the top and then written. And we've got the word conducted. So the tests conducted were positive. And by using just a small verb like this in this way, it makes it really concise. And that is part of the writing criteria. So it's a great little sentence, that, because you've just taken everything in the case notes and completely transformed it into a sentence. And we then have this small bowel biopsy, and everything from the small bowel biopsy to the lymphoma, everything there is written in the next sentence. And again, we've got revealed. So when you say that a test reveals something, or the X-ray reveals, a biopsy revealed, a CT scan reveals, these are all strong collocations. And as well with revealed, it's a really nice verb to use in OET. If you look at OET sample letters, you'll see the verbs conducted and revealed everywhere. It's really good words to learn how to use properly. And then we've got but excluded. Now, it would be very easy to put these two case notes into two separate sentences. But what they've done is they've just linked it. That linker, but excluded bowel wall lymphoma, is really making it concise. So now we're on to that section of really semi-relevant things. So it's nice just for the dietitian, as we said before, to know that she has asthma and that she takes something, and that she's going to take her usual medication of ferrous sulfate, and the dietitian will know that this is for anemia because that's what the medication is. And everything else there, including the calcium levels, can be related back to diet and related to celiac disease. So that's the reason that we've got it there. Now, we use please note that to add anything extra that we think that the recipient should know about. So very often for any kind of secondary issues or something like this with a medication or semi-relevant, it's quite nice because it's almost like a, oh, by the way, you know, if it was speaking, we'd say, oh, by the way, Rosemary suffers from asthma. But this is a much more formal, clinical, professional way of writing it. Intermittently is a really nice adverb. It just means off and on, but again, like on and off or off and on are a little bit informal. You can use them in speaking, but not really in writing. So intermittently is a really good adverb to use. For which, a preposition and a relative pronoun. All of this kind of language we have had lessons on before on the OET Facebook page. So do scroll through, and if you want some help of language for writing, there are many other videos on there and also on our YouTube page. So do have a look for those, and they should help you a bit with grammar if it's something you struggle with. We've got is due to, which is a really nice formal way of talking about something that is going to happen. And will also be checked. We've got a future passive. The reason this is passive, we can see the verb be and then the past participle checked. So with the passive, it's that the object of the original sentence will be more important than the person or the thing that does the action. Here it's important that the calcium levels will be checked, but it doesn't really matter who checks the calcium levels. Have a look at the next bit. Okay, now when it comes to structuring your paragraphs or structuring your sentences, what we often think about in English is starting with the topic sentence. And a topic sentence is basically, if you imagine a paragraph, you've got your first line, which is the introduction. So that's the topic sentence. Here, the writer is saying, this paragraph is about the family's conditions. So that is our introductory sentence. And then our next sentence, as you will appreciate, Rosemary's family therefore already have conditions which necessitate particular attention to diet. And this is what we would call a supporting statement. So this is something saying, oh, and here's some more information about this. So it's, why are you telling me that the mother has diabetes and the father has Crohn's? It's, well, they already have conditions that need diet attention. And then finally, we've got a really clear explanation. So it is important that dietary amendments for Rosemary do not impact too much on existing restrictions for some members of her family. And again, in the last lesson that we did last week, we looked at writing and sample letters and highlighting really good information. There's loads of good information in this. So that is a really nice line, as you will appreciate. and which necessitate particular attention to diet. So if I was a student, I'd be writing all of this down now. Some really good language here. And then finally, we have our closing statement. And there's so many different ways you can do this. Just find one that works for you and use it. As long as it's relevant for each letter, you can choose what closing statement you want to write. So here, please contact me if I can be of any more assistance. But you could also just use a conditional. If I can be of any more assistance, please do not hesitate to contact me. I've got another conditional here. Should you have any further questions, please do not hesitate to get in touch. Or thank you for your assistance in this matter. Something like this would work. Any of these four, and there's a lot of other ways you can do this, would be good, but make sure that you do put a closing statement in there, and that is included in the word count. So the body of your letter includes your paragraphs and it includes your closing statements. And then finally, yours sincerely, and you'll put your name and your job title. So for example, if you are, I don't know, Dr. Wilson, you say Dr. Wilson, GP, or whatever is relevant to the letter. Now let's have a look at the organisation of this letter. So we've gone through individually, but it's hard to almost imagine it together. So we're going to look at the whole letter now. So we can see our first sentences. This is our introduction or our purpose. And we can see the purpose, we know it already, it's the management of her gluten-free diet. We've then got the really important information, so her main symptoms and her test results. The person we're writing to already knows what we want them to do, so now they're just looking for more information. They might be thinking, well, why do you think she has celiac disease? And this is just proving what her symptoms were and anything that was a positive test. And then we've got semi-relevant information. So here we're talking about her medication, which is slightly related to her diet, like that ferrous sulfate for anemia. And then we've got the information related to her family, which is relevant information. Now with this, you can see it's almost like relevant, semi-relevant, relevant. But what you could do is switch those last two paragraphs round. So you could have the main symptoms and the test results, then the information about the family, and then finally the information about her medication, and then your closing statement. And either of those would work. Now looking at the way to start it, in the, in the writing criteria, the beginning of your letter, part of the writing criteria is organisation and layout. So this bit, the beginning of your letter, is included in that layout. So make sure that you're doing it right. It's something really simple that, you know, once you've practiced your writing over and over, you'll just do it, you know, without thinking like, okay, this next. So the right way to do it, start with the recipient's name, then their job title, and then the address. Remember, the address is always in the writing task at the bottom of the case notes. And then you can start with the date. And then finally, who it's referring to, or who the letter is regarding. In this case, Miss Rosemary Smith. And then we've got her date of birth as well. And the Dear Dr. Jones, it's normally, we normally see it above the RE of who it's regarding, but you could actually do it the other way. It doesn't matter too much. And the Dear Mr. Jones is, of course, referring back to Dr. Barbara Jones. Now, something that can be quite confusing is, should I use yours sincerely or yours faithfully? Well, if you know the name of the person you're writing to, then it needs to be yours sincerely. So for example, in this letter, we know it's to Dr. Barbara Jones. We know that person's name, so we'll use yours sincerely. If you don't know the name of the person, then you can use yours faithfully. But if you know the job title, like the charge nurse, then you can use yours sincerely. It's not very often at all in OET writing that you don't know the name of the person you're writing to. You will normally know either the name or the job title, but occasionally you might not have a name, so then you would put yours faithfully. But most of the time, if you stick with yours sincerely, you'll be okay. And again, this is being marked in the organisation and layout part of the marking criteria. So we're going to go through the whole letter, just with a little bit of vocabulary. I'm going to give you a minute and a half. See if you can type your answers in for the gaps here into the comments, and then we'll go through it together. Okay, hopefully that was enough time for you. So let's go through them individually. The first one should be diagnosed, recently diagnosed with celiac disease. As well, because that preposition with was there, that's only the answer it could be, really. With the next one, I'd be grateful if you could, maybe something, you might have written something like advise, which would work. In this letter, it was instruct. Instruct is also fine. Rosemary was to the paediatric unit. Possibly you wrote referred or brought or sent. Transferred is what was in the sample test. She also, considerable weight loss. You maybe had something like suffered. Here we've got reported. She reported considerable weight loss. A small bowel biopsy revealed is probably the best answer. Remember that with tests, revealed is normally the best verb to use. Please note that Rosemary intermittently from asthma. Maybe you wrote something like suffers, which is our answer here, suffers from asthma. And finally, the next one, when CBC and calcium levels will also be checked. Yep. And the last one, it's important that dietary amendments for Rosemary do not too much. And the answer here is impact. If you wrote something like encroach, that would also work. It's a quite a proficient level of English, that, but yeah, do not impact too much would be great. Okay, so make sure that in the writing that you read the task first. In those 5 minutes, really make the most of the time you have. Go through, start with the writing task, because that way you can work out who you're writing to, what the purpose is, and then you can go back through everything else. I would tend to look at the writing task and then go right to the top and see who I am, and then I'd go back and look at the discharge plan, and then I would go from the beginning. but you'll find a way that works best for you. But yeah, do read everything in as much detail as you can first, so that as soon as you're allowed to use your pen, you can start marking what is relevant, semi-relevant, etc. Identify the purpose. As soon as you can, find why you're writing to that person. And purpose is the first part of the writing criteria. So it's something specifically that they're looking for when they're marking your writing. So make sure that it's really clear. Select all the relevant and semi-relevant case notes. If you're not sure, mark it as semi-relevant, and then you'll see as you go through your letter, you'll work out a little bit more about what is needed and what's not. But remember, everything relevant is going to be something related to the disease or whatever they have, related to their symptoms, and related to the person you're writing to. Like in this case, it was a dietitian, so the blood counts were not really important. Organize the letter logically. So think, well, what's the most important thing that I need this person to know? And maybe start with that, and then you can go through to the secondary issues. Transform the case notes, don't copy them, use your own language, practice paraphrasing, and again, go through sample letters and find any language that you want to use yourself. And proofread. So proofreading is so important, like we said at the beginning, just to go through, if you know you struggle with specific grammatical things, maybe it's prepositions, go through and check all of your prepositions to proofread it properly, because you don't want to miss out on some marks purely because you were so sick of the task that you didn't want to read through everything at the end. So that's everything from me today. At West London English School, we offer a range of courses. So I'm just going to give you a little bit of information about them now. So we do have writing online packages where you get video lessons on language, on grammar, how to select case notes. And you will also get writing tests, writing practice that are marked by our experienced OET tutors at the school. We have a writing correction service. This doesn't include the video lessons, it's just the letter. So if you want some case notes, we'll send you case notes. You write your letter, send it back to us, and we will give you feedback and the sample letter and your marks. We have an online listening course which includes video lessons and 6 practice tests. We have speaking video lessons and actual role plays that you have with a tutor. So you would be working with either Harmy, myself, or Catalin, and we would actually have an actual, a face-to-face or an online lesson going over speaking with you. We have reading courses as well. And we have complete packages for everything. So we have a platinum, gold and silver, and you can see the details of that here. If you go on our website, which is www.wles.net, you'll see all the details of our online and our face-to-face OET courses, which take place here in Ealing in London. Here is our team. There I am in the middle. We've got Harmy, who is our head of OET, and we've got Catalin, who is a speaking interlocutor, who again is probably answering your comments on Facebook right now. And Harmy is teaching an OET class right now. So we're all busy with OET today. So thank you for watching. I hope that you found the session useful. And I will be back next week. I think we're doing reading, so we'll be doing a full reading mock paper and going through some strategies on how to do well with that. So hopefully you'll be able to join us. Yeah, do take care, and I wish you all the best in your OET preparation. Bye.